Hyperbaric oxygen therapy has arrived in South Mississippi, and we are at Coastal Hyperbarics with Dr. Bowen. Thanks for being with us.
Thank you, sir.
Well, thanks for allowing us to hear, because we're in your space here. So tell us, what is hyperbaric oxygen therapy?
So as you know, it started for dive accidents. Basically, you're forcing gas back into solution for dive accidents specifically, and then allowing it to passively come out. And they discovered that whole idea of utilizing pressure and 100% oxygen worked fabulously for many other things, like diabetic wounds. You can use it now for avascular necrosis in joints, especially for people that have sickle cell, so they don't need a joint replacement as soon, and things of that nature.
So what we're saying is that this is not something that is like, we start this and we don't do anything else. This kind of works alongside other therapies.
Absolutely. This is an adjuvant therapy. So I always joke, I don't want to steal any patients. I want them to go see their primary care. I want them to go see their specialist, their orthopedist, all of that. They need to do all of their regular stuff. All we do here is basically make their specialist look better. We just take what they're doing and make it better.
Hey, who doesn't like that?
Right.
What specialist doesn't like that? Because especially when you're talking about individuals who are suffering from cancer, who are going through treatments that it is breaking down areas of their body that they have to heal before they can go back and get more treatment. You guys step in and speed that process.
Correct. We try to help out as best we can. The human body is an amazing thing, and it'll do a lot of healing on its own, but a lot of times it needs extra help. And whether that's from medications or hyperbarics or what have you, we do what we can to help out.
Now, I recall the very first time I ever remembered anything about hyperbaric oxygen therapy or chambers was the Michael Jackson. Like, that's the first thing I went to, and technology has wildly evolved since that.
Sure. So Michael Jackson believed that he could live to be 150 if he slept in his chamber every night. We don't condone that, obviously. Sure. And Michael Jackson did not die because of the chamber. They gave him propofol, and the chamber actually accentuates medication. Right. And the doctor he had on scene couldn't take care of that. But yeah.
But he originally, that started in his life because of the injury that he had when he was burned.
Correct.
So it's still assisting in wound care.
Sure. There are about 14 to 17 things that are covered by insurance, and thermal burns are one of them.
So what do you say to those individuals who are watching that may be interested in taking maybe the first step?
Well, it depends on if it's an insurance dive or not. If it's not, if you want to do this for wellness or something that there's been benefit shown, but it's still not covered by insurance yet, then it's as simple as just calling us and making an appointment. You come in and we'll schedule everything else.
Give me a handful of those things that are maybe covered by insurance.
So covered by insurance, obviously, would be diabetic, chronic wounds, things like that. Avascular necrosis, like we talked about. Thermal burns, like you brought up. Another big one is intercerebral abscesses are actually covered. It's one of the only treatments for them.
Right.
So there's a whole list of them. But,
and when you talk about cancer, the radiation side of it is covered.
Correct. So unfortunately, even though there is benefit, insurance won't pay for just someone with straight cancer. But if you've received radiation therapy to the chest, the pelvis, sometimes even the head, and you have necrosis of tissue or bone, then that is covered by insurance.
So what does it feel like? You guys call it going on a dive.
Right.
So what is it once you're in the chamber? What does that feel like?
So our chamber is a little different because you sit in it as opposed to lying down like some of the ones you see on the walls here. So it's kind of just like sitting in an airplane chair. But the feeling, if you've ever gone on a scuba dive, is kind of like that, or going in a deep pool, how your ears start to pop the deeper you get. It's that same feeling. It's just instead of going into a 10-foot pool, you're going about 45 foot of seawater.
There you go. So how does this, are there other chambers in the area? And if there are, how does this one differ?
So I believe there are a couple inflatable chambers at maybe some of the wellness centers. This is vastly different from that. Those are usually inflatable zip-up chambers. They can only go at max to 1.5 atmospheres, which is not therapeutic depth for most things. And you don't have a true oxygen source. Most of them are like a percentage of oxygen you're breathing. Mm-hmm. The other chambers on the coast would be in the hospitals. They have chambers, but they are monoplace chambers. It's just a big tube that you lie in. You're covered in oxygen, and you just sit there for your treatments. Ours, like I said, you sit down in it, the chairs recline. We have a space where you can watch an iPad in there, you can read, you can sleep, and you wear a hood and you breathe 100% oxygen. So you're not completely covered in oxygen. The compression gas is just air.
So whenever someone comes in and they're here for an appointment, how long does that process take? What does that look like?
So again, it depends on what you're treating. If it is something like dementia or PTSD, traumatic brain injuries, even autism, those are not yet covered by insurance, but the data shows that the shorter duration, so maybe 1.75 atmospheres for an hour, is better for them. But if you're coming in for a chronic diabetic wound, then you're usually going to go to about 2.5 atmospheres for 2 hours roughly.
So it's a lengthy process. Is there any kind of like hangover? Is there anything like what? Because when you're okay when the treatment's over to get in the car and drive home.
Sure. The main thing, a lot of people actually feel more energetic, which is what Michael Jackson liked, is that when he got out, he felt like he had more energy.
Sure.
Because oxygen is actually used to make ATP that you use for energy. But one of the other things it can do is it can actually drop your sugar a little bit. So some folks come out feeling like their sugar's a little low, and just takes a minute to correct that. But that's the only real, I guess, lethargy type thing.
Sure. Are there anything that you would need to do before this therapy? Can you just come in? Should you not have anything to eat? Is there a...
So you're going to be in the chamber for 2 hours, so I probably wouldn't drink a lot.
There you go.
Go to the bathroom before you get in. But also, because you're around 100% oxygen, there are certain things we have to adhere to. Now, this is obviously not a hospital setting, but we adhere to all of the guidelines as though it were. So you can't do your hair beforehand, no fumes, basically no hydrocarbons. Don't do your nails. If your glasses have a lot of wire in them, you can't wear those. No watches, no electronics, things like that.
So there are some, because it's the oxygen that's in the space, right?
Correct.
You don't want any fire problems.
Correct.
That's a no-go.
We don't like that. We like treating burns. We don't like causing them.
There you go. Yeah. So I think what I'm getting from this is definitely something that you're going to have alongside of your normal treatment. This is just going to help speed the process.
Correct.
Yeah. So listen, if you're interested, if you have questions, give them a call here at Coast HYPERBARX. They're happy to answer all the questions that you have. They'll get you on a schedule to come in. How many of these do you think normally it takes?
So right now, it depends on what you're treating again, but usually you need at least 20 to get the full benefit. And then for some people with chronic wounds, you're going to need close to 60 of them.
Well, there you go. Listen, you see that number at the bottom of your screen. Give Dr. Bowen and his team a call, and they'll get you on the track. Thank you, sir.
Thank you.